Good afternoon. Can you hear me?
Yes.
Okay, thank you. Today I'm going to do the practice class on collection and transport of specimens. Have you done the lecture on this one? Okay. And what's the importance of knowing this collection and transport of specimens? What do you think? Why is it so important? One thing is that in exam point of view, you will get invariably the last section. If based on there will be 3 parts of the question number 4, asking about you will be given some disease like last time it was given as renal tuberculosis, and then you have to write about the laboratory diagnosis, and then it mentioned special reference should be given to the collection and transport of specimens. Therefore, in theory paper, you will invariably get one session that is consisting of 3 parts in the exam paper, as well as in OSCE, you will be given this container and will ask about 3 questions. Okay, and even in Viva exams, you will be asked about collection and transport of specimens. Okay, that's the exam point of view. But other than that, once you become doctors, you have to advise your subordinates or maybe the other category of staff regarding the collection and transport of specimens, because isolating a pathogen is basically totally depend on the quality of the sample that you are going to collect. If you do not collect a proper sample, contaminated sample, it will give wrong result, as well as it will not treat the patient as the correct, using correct antibiotics. Okay, that's the importance of knowing the collection and transport specimen. I will play the video. Just tell me that if it is not clear. Okay. Yeah, okay, now this video shows how do we sterilize a wire loop. Okay, you know this a part of the lab with the immersive technician is sitting at the bench, and then this is a bench area that we work usually for culturing inoculating culture plates. Okay, there's a plate, blood culture plate, and the Bunsen burner, and this is the place that we work usually in a microbiology lab for to bacterial with the samples, clinical samples. Okay. Yes. And this is the sample. Now he is going to sterilize the wire loop. Okay, now can you see the wire loop is getting red hot? That's the way of sterilizing wire loop. Okay, what's the method that we use here? You have done sterilization and disinfection. Now, what's the method that we adopted here? It is heat. What type of heat? If it's
dry heat.
Good, dry heat. Okay. In developed countries, they don't need this type of sterilizing wire loop because they have disposable wire loop. That means once it's used for, they can dispose the wire loop. Okay. But here in our country, we don't have, because those are expensive and we don't have that much of money to expend for this type of work. Therefore, we have to reuse the same wire loop by sterilizing the wire loop. Okay. And that means, is it okay if I talk while the video is going on? Then is it, what do you think? Will that be audible if I talk while the video is going on, or shall I stop the video and talk to you about this one?
Madam, it's okay. to talk while the video is playing.
Yeah, okay. Then, okay. I will reduce the sound bit here and then, now what she said, this one recording that we did last time, and the temperature of the wire loop, once it is red hot, is around 800 degrees. That means it kills all the pathogens in the wire loop. Okay, that's how we sterilize the wire loop, and then we have to wait until it gets cold. Okay. And then the sample is in this bottle, and then now he is going to take the amount of the sample into the wire loop. Okay, and this is a blood culture plate. Now he is inoculating the sample. Okay, the term that we use is inoculation. Okay, and he has made a heavy inoculum, that is the gel, what we call as a gel, and now from there onwards, he squeezed out the sample all over the plate. You won't get hands-on experience for this treating, okay? Don't worry. And he has treating once, and then he's again doing it to spread out the sample all over the plate. Now you can see he has turned it to a clear area, and now he is going to again squeeze out the same sample. The idea of doing squeezing out is to get isolated colonies. Okay. Yes, that's all for that. Then we will go on to the second one, and then we will talk about the collection of sample of urine. First, we will talk about the from a catheterized patient, and then we will talk about the sample from other patients, because it's one of the common condition that common sample that we collect in our day-to-day clinical practice. I think because as this the video doesn't contain the collection of the urine sample from a normal patient, I will describe it now at this moment. And before talking about collection and transport of specimen, what do you have to know? What are the points that you have to think about? What do you think? There's a patient with some clinical condition. Let's think about that the patient is having urinary tract infection. Then, what do you think? What are you going to say regarding the collection and transport specimen? First, you have to think about the patient's condition, and then you have to think about the samples that you are going to collect. What are the what's the sample that you are going to collect in a patient having urinary tract infection?
Urine sample.
Yes, urine sample. And then you have to think about, that is what you have to collect. You have to think about what are the samples that you are going to collect, and then what's the next point of that you have to take into consideration. What's the sample? Now you know what's the sample, and then what is the next point of regarding collection and transport of specimens? What you have to think about?
The container.
Good. The container. Yes, and then
how to collect the sample.
Good. How to collect the sample? Yes.
And about making the area sterile.
Okay, good. Yes, how to collect that means the methodology, procedure, as well as any other thing?
The transport of specimen.
Yes, transport of specimen, one of the most important parts. Okay, when you ask about the collection, you have to write about the transport as well. Okay, and one more thing.
Quantity of
the quantity. What do you mean? Is it quantity?
Whether we need a text avoided one or.
Sorry, I didn't get that.
the time duration?
Good, very good. Yeah, that's the one I am expecting, the answer that I am expecting. That means the when to collect the sample. Those are the important points, okay? Actually, when you ask to write about the answer, you have to include all these aspects. What is the sample that you are going to collect, and how to collect, and the container, and when to collect, and the transport. Okay, all these aspects you have to write, okay? And if you are keeping in mind that all these aspects you have to write, you will get full marks for those questions, okay? And then urine, we will talk first about the urine. Here in the video, they talk about only the urine sample from the catheterized patient, okay? What about the normal, without a catheter, a patient having UTI without a catheter? And what's the sample that you are going to collect? Urine sample, you said once you said correctly, but is there any specific term that you have to mention? It's just urine or stream? Yes, very good. It should be midstream urine sample, okay? And can you explain, because I told there's a Marmite bottle, that's why I am going to, and also there's you can see commercially available container, and both these are the Marmite bottles are the in-house prepared ones, and these are the commercially prepared bottles available for collection of sample of urine. And then how are you going to collect it? Can anyone, if it's whoever the patient, how are you going to collect it? Can you just explain a few points? First, what you should advise the patient, what you should ask the patient to do.
To wash the external which using soap?
Yes. First, you have to ask the patient to clean the external genitalia with soap and water. Yes, very good. And
then give advice to don't collect the initial part of the.
Yes. Yes. Yeah. Okay. Good. Let the first part to flow out to the container, and then only take a sample from the midstream. Okay. And you should not touch the inside of the bottle, as well as you should not contaminate it. If the stool or some other thing, you should not contaminate with the thin commensals as well. Okay. And then why do we collect midstream sample? Why not? Why do we specify it? What's the reason? You can collect the whole sample, or you can collect the last part. Why? Or it's not the initial part. Why? Why should it be the midstream?
To get rid of the commensal flora.
Yes, very good. And can you explain a little bit more? Why? How are you going to get rid of the commensal flora? Yes, what you said is correct. And because the urine comes out through the external urethra. You know, external urethra is not a sterile area. It consists of lot of commensal flora. Therefore, by allowing to go out, we hope that the organisms within the external urethra may go out with the first part of urine. That's why we are going to collect the mid part, from the mid part, midstream sample, and also because it's again presence of the urine quality is a semi-quantitative one. That means just presence of single organism, we don't consider it as having UTI. Okay. Do you know the cutoff point that to consider as a UTI? Because how many organisms that we should have in the sample? It is 10 to the power 5, okay, equal or more than 10 to the power 5 bacteria, or you may have seen CFU in the report, that means colony forming unit per ml. In a 1 ml is considered as having urinary tract infection. Okay, sometimes depending on the clinician, they will take even 10 to the power 4 and 3 also with, if the patient is symptomatic. But ideally, what we say is to diagnose a UTI, patient should have in his urine or in his urine amount of bacteria, pure growth of bacteria, amount having equal or more than 10 to the power 5 colony forming units per ml. Okay. Once you go to what, just see the report how they have interpreted or how they have commented all those reports. Okay. And yes, and then can you describe about the container as well? Yes, now we have advised the patient to how to get a mixing sample, and then how do you what's the type of container? What's the container? How do you describe the container?
Wide mouth.
Good.
Sterile.
Yes. Yes, you are correct. Any more adjectives?
Screen cup.
Sorry? Screw cap. Yes. Screw cap. It can correspond to one. Yes. Okay. Yes. Those are the points. That means sterile should be sterile. Okay. Always remember to write sterile because we should not get collect into clean. You know the difference between clean and sterile. Clean means there could be some organisms, but for this purpose, we have to get a sterile. Always we try to get a sterile container for all the samples. Okay. Except in few conditions, I will let you know what are the conditions that we get a clean container. But as a whole, you have to get if possible, you have to get not if possible, always you have to collect into a sterile container. Okay, this should be sterile, leak proof, screw cap, wide mouth, and dry. Okay, container. And then regarding ears, we have collected sample, and then regarding transport, what do you say? How do you advise to transport to the lab? What do you say?
It should be transported within 2 hours.
Yes, as soon as possible. If not, at least within 2 hours, or if not, if there's a delay for more than 2 hours,
we have to keep it in a refrigerator.
Good. We have to keep it in refrigerator up to how many hours?
6 to 8 hours.
Good. Okay. Yes. Or 8 to 10 hours, and kept it in ice. And if not, if it takes more than that, that means a sample should transport from here, from they have to collect as a batch and then have to transport.
And boric acid.
Yes, good. Should include a chemical like boric acid. Okay, yes. That's the point that you have to keep in mind. And why do you want to keep it in the fridge? Why not outside?
Restrict the growth of bacteria and other organisms.
Yes, very good. And not only the another organism, that means not only the commensals, but also the probable pathogen. Okay, I told you that it's a semi-quantitative value. We are going to calculate the semi-quantitative value, the colony count, and if the number of colonies are less than around 10 to the power 1 or 2, this time it may go up to more than 10 to the power 5. That means giving false positive results for UTI. Okay, therefore, even for the pathogen, we have to restrict the growth to get the value. Okay, to get the proper value to diagnose the UTI. Here, that is, yes, good, very good. And then I will display, and this is, and also another important point. If you can collect if you can ask the patient to collect if possible, the early morning sample, that would be better. Okay, or early morning mixing sample, because early morning means that the patient has some amount of the urine gets concentrated. Okay, therefore early morning mixing sample would be much better than the other ones. Okay, yes, I will now play this video. there is a urinary catheter, and you can see the whole the little catheter part, and the tip is here, and then it's made of rubber, and this you can see there is a bifurcation, and to the catheter you can see there is a bag, urine bag connected, and also there is a, at the end of the bag you can see a opening covered with a cap. Okay, and if they want, once the urine gets collected here in the bag, you can remove the collected amount of urine through this cap. Okay, and also once now this urine catheter goes into the bladder. Okay, bladder, what do you say about the bladder? It is a contaminated sterile site or contaminated site with commensals.
Sterile area?
Yes, it is sterile. Sterile. Okay, therefore the catheter goes into the bladder, which is a sterile site. Therefore, we have to maintain. If you are doing some, if you are keeping some instrument in the sterile site, we have to make it as a closed system. Okay, you can see the system is closed at every point. Okay, even the opening is covered with a cap, and also you have, as when you are working as house officers also, you have to make sure whatever instrument, maybe the cannula, you have to keep it closed because you have to maintain the closed system. Otherwise, if you keep it open, the organisms will enter into enter through this opening into the instrument, and then it will go into the bloodstream of the patient causing septicemia. Okay? And here, as you mentioned about the bladder, I want to mention another important thing: presence of even a single organism, single bacteria in a bladder sample is significant. Okay, in a mixing sample, if the presence of 10 to the power equal or more than 10 to the power 5 organisms, but in the bladder sample of urine, presence of single organism is significant. Okay, and how do you take a bladder sample actually? How do you take a bladder sample of urine?
Suprapubic.
Yes, very good. Suprapubic catheter. Okay, not the normal urinary catheter. Okay. Yes. And then you have to know where you are going to collect the sample. Okay. If you are going to collect the sample from the bag, it is not good because it is gets contaminated in external environment. And also, if you are going to collect through puncturing this tube, it is not possible because it's very hard. Also, you can't puncture the tube unnecessarily, or you can't puncture it because it will the opening remains open, and then again our aim of having closed system is broken. Okay, therefore you have to maintain the closed system as well as, and then we will see how we are going to collect the sample of urine from catheter station. Do you have any idea from which place you have to take? Do you have any idea? Are you going to collect it from this tube? No, not that, not from the bag, but then is it from this end or that end? Okay, I will show this. Okay, now you know this the small from this bifurcation, a small one is for the injecting the water into the this catheter because we want to insert the bulb at the end of the tip to retain the catheter in situ. Okay, and the other one is to get the urine out into the bag. And then first of all, we have to take the urine from we can't take it from the tube, we can't take it from this plastic, the rubber area. Then we have to get it from the source to the bifurcation. I will show you where it should be get. But before that, you have to clamp the catheter to allow it to collect the certain amount of urine. That means we need to have at least 3 to 4 ml of urine. Therefore, we need to clamp the catheter. Okay, but this not the correct way of clamping it. We don't need to bend it like this to clamp the catheter. Okay, just at a one point you putting a gauze top, you can use a clamp. You can clamp it. Okay, and then we have to wait until the urine gets collected here, okay, in the tube. And also remember, if you are handling patients' belongings, you have to wear gloves. Okay, which type of gloves you have to use? Which type of, it should be clean gloves or sterile gloves? Now you are handling patients' belongings, patients' surroundings, or the patient. Which type of gloves you use?
Sterile.
Why? Why sterile? For clean. Is this an aseptic procedure? You know the meaning of aseptic procedure? Can you tell me aseptic procedure and aseptic procedure? Aseptic procedure means actually we have to maintain sterile conditions throughout our procedure. Okay, that means actually, as example, when you are taking a sample of blood for culture ABSD or when you are taking a sample of CSF, you have to maintain. You have to do it as an aseptic procedure because CSF as well as the blood stream inside our body means the sterile area. Therefore, we should not allow organisms to enter into these sites by our fault. Therefore, we have to maintain sterile conditions all when we are doing the procedure. Therefore, those are the aseptic. We have to maintain the aseptic conditions. Okay. And what about taking a sample of urine? Is it aseptic or clean procedure?
Clean.
Yes, clean procedure. We will say as a clean procedure. Therefore, in that case, we need only a clean glove. Okay. But if you are going to take a sample of CSF or sample of blood for culture ABSD, you have to use sterile gloves. Okay. Otherwise, clean gloves will be enough. And the use of when to use sterile gloves and when to use clean gloves, we will learn when we do the lecture on infection control. Okay. And if we keep the clamping for 5 to 10 minutes, the urine will collect in this area, okay, in the tube, okay. And then, what do you think? Where do you puncture? And before puncturing the site, we have to clean the catheter, okay. Clean with what? What do you think? What is the disinfectant that you use to clean?
70% is alcohol.
Yes, very good. 70% alcohol or the surgical stick, we use it to clean the catheter. And usually, we have to clean for 30 seconds because it takes some time to act on the surface, okay? And also it's clean in concentric manner. from inside to outside, and we should not touch any other areas with the same soap. Okay, and then let it dry again, and okay, and the exact site is 1 centimeter away from the bifurcation. Okay, usually around 1 centimeter or 1 inch away from the bifurcation. And once 30 seconds over, you have to leave the catheter to get dried. Okay. Now you can see the surface get dried now, and then using how are you going to collect the sample? Then you have to get a sterile syringe and a needle. Okay. And the next question is that when how are you going to puncture it? Okay, you can puncture from toe to head or head to toe. What do you prefer? Is it toe to head or head to toe? And out of these two areas, this area you can't puncture, because this area, the canal, the tube channel, it contains that we use to inject the water into the bulb. Okay, if we puncture this one, the water will come out, and the catheter will come out from the patient without retaining it in the bladder. Therefore, you have to puncture this area, and then the next question is how to puncture, whether it is head to toe or toe to head. What do you think?
Head to toe.
Very good. Head to toe, because once you puncture, think about later, once you puncture head to toe direction, the urine will not come out next time. Okay, because as you are not going to change the catheter to get the once you get the sample, therefore even after that it will act as a valve preventing our urine coming out of the tube. Okay, therefore head to toe position means towards the back. Okay, we have to pierce the catheter towards the back. Okay, I will show you now. Now directing towards the head or the back. Okay, that's the head to toe direction. And then take the required amount of maybe 4 to 5 ml is enough for culture. Actually, for culture we need only less than 1 milliliter, but for we can do the UFR with the same sample, and then therefore we have to be better. We can take around 3 to 4 ml of urine. Okay. Now this is now she is demonstrating how to recap the how we should do the recapping. Okay, because you know what's the danger of doing keeping the cap in hand and then doing recapping. What do you call this method? This is what we call as scooping. Okay, so scooping method to prevent needle stick injuries. Okay. Now you have not touched the needle with your fingers, therefore you won't get any needle stick injuries. Okay, and the needle you have to dispose to where? To the bin, and the urine sample should be put into our container. Sterile, leak-proof, soap-capped, white mouth dry container, and then we should not touch the the sample with the mouth of this container. Now once it is over, we have to clean the side because to prevent organisms getting into the urinary tract. And once it is over, we have disposed the top as well as the gloves, and then we have to wash your hands with soap and water, and then you can label, then you can put on another clean gloves, and you have to label the specimen correctly. Or if not, if you have many samples to take, you can label the specimens, label the containers beforehand, before collecting the urine. Otherwise, it will get mixed up, and also it takes more time if you do after collecting the sample. Okay? Any questions? Do you have any questions so far? That is all for collection of collection and transport of specimen of urine. Now we will see collection of fecal specimen. Okay, can you see the screen?
Yes, madam.
Okay. Any questions so far? No? Okay. And feces, feces again is not a sterile sample because feces comes through the large intestine, and therefore it contains lot of commensal stored acids. But when do we take fecal specimens? Can you give me any indications to collect sample of feces? When do you collect a sample of feces?
When there are symptoms of parasitic infections.
Okay. And microbiology? How do you think of microbiology? Cell aspect. When the patient is having? Diarrhea, yes, diarrhea, and if you think it is due to infective cause like Shigella, Salmonella, we can collect a sample of stool. Even in poliomyelitis, you will learn when you do virology. In poliomyelitis, to isolate the viral organism, poliovirus, we do collect a sample of stool. Okay. And here for bacterial pathogens, we collect a sample of stool, and then we can't ask the patient to pass the sample of stool directly into the container. Therefore, what we have to ask is first pass feces into a clean bedpan. Okay, because we know that it is not possible to sterilize a bedpan. Therefore, we can ask, and also it actually is not mandatory because all the stool also contains some amount of organisms. Okay. Therefore, we can ask the patient to first pass stool into a clean bedpan, and then from the bedpan we can collect around 1 or 2 teaspoons amount of one is enough. 1 spoonful of stool into a container. And again, in this condition, we can give a patient to a clean container, but what you have to keep in mind is preferably sterile, because we should not contaminate more with the organism our sample. Therefore, if possible, we can do a sterile sample, but if not, clean water container would be okay. Okay? And here it's a commercially available one, and sometimes commercially available containers may contain spoons as well. And then, how do you advise the patient? You can advise the patient to pass stool into clean bedpan, and then we have to ask the patient. We have to give the container to the patient, and then also we have to ask the patient to collect feces from about a spoonful of feces from containing mucus, pus or blood. Okay, and then before that you have to advise the patient that he should not contaminate the stool with urine. Okay, because if you pass urine onto the stool to pathogens, they may die. Okay, and how do you describe this container? I told you clean, but preferably sterile, and it should be dry. Any more adjectives?
Disinfectant free.
Very good. Disinfectant free. And leak soap. Leak soap means that the sample should not spill out from the container. Spill නැති සහ screw cap. Screw cap කියන්නේ මේ වගේ bottle එකේ screw තද කරලා වහන්න පුළුවන් කියන එක තමයි හොඳ. Okay, screw cap bottle. Okay, and then what about this yogurt cup? What do you think? Yogurt cup?
Not that good.
Yes, not that good. Can you give me a reason?
It is not leak proof.
Yes, very good. It is not leak proof. Therefore, we should not encourage the patient to send the sample from this type of container, because it is not a leak proof one. Okay, and that is all about the collection of stools. And once you collect the specimen, what do you do? And there's one more thing to say, and if the patient cannot give a sample of stool, another sample is rectal swab. But keep in mind, the stool sample is always preferable to rectal swab. Okay, because rectal swab, we won't be able to take much amount of sample. Therefore, if the patient cannot give a sample of stool only, we go for rectal swab. Okay, and then for this one, we have to insert the swab into the rectum, rotate, and leave for about 10 seconds and withdraw. Okay, and if the swab should be sorted within 2 hours of collection, and replace or if not, you have to use a transport medium. Okay, and also even for stools, you have to transport within 2 hours of collection, and until that time you have to refrigerate the sample, and if not, if there is a delay of more than 2 hours, you have to use a transport medium. Okay, and what are the transport medium that you can use? Any idea? And this one shows the commercially available swabs. We can use this one, and this one is a in-house prepared one that we prepare in our laboratory. And then, can you tell me about the transport media? Do you know anything about transport media? Okay. Until dispatch to lab, we have to keep the sample in the fridge. Why do you need to keep the sample in the fridge? Any reason? Can you give me a reason?
To restrict the growth again.
Yes, to inhibit the growth of commensal organisms. Because I told you that feces contain lots of organisms like E. coli, other than the true pathogens, the diarrheal pathogens. Therefore, we have to inhibit the other organisms because why? Not because we are going to isolate, but because of once the other organisms grow, they will excrete the excretory medium gets acidic. The medium gets acidic, and then the pathogen gets died. Okay, therefore, because we don't need to worry about the presence of other pathogens here, because in stool cultures we use selective media. Okay, like Salmonella, Shigella, Aega, you will learn those things. They can, in those media, only the pathogens like Salmonella, Shigella can grow, not other organisms. Okay, therefore, we have to inhibit the presence of other commensal organisms because by growth of them can cause turn the medium into acidic, and then they can cause the diarrheal pathogen to die. Okay, and what are the transport medium you know? Do you have any idea?
Alkaline stone water.
Sorry? Yes. Yes, alkaline Peptone water. Yes, okay. Yes, alkaline Peptone water.
VR medium.
Good. VR medium, Venkataraman Ramakrishnan medium. Especially for cholera. And any other medium that we can use for all diarrheal pathogens?
Cariblear.
Yes, good. Cariblear. Cariblear is actually this one is the Cariblear. It's a semi-solid medium, semi-solid transport medium, whereas this alkaline Peptone water and VR medium are liquid media. Okay? Yes, very good. And if there's any delay for more than 2 hours, the cup can be inserted into the Cariblear medium. Okay? What you have to do is put the cup into the bottle media and then break it from a point that it closes. Yes, one more thing that you said the Salmonella Shigella survive in this Cariblear medium for 48 hours. That means for 2 days. But for Campylobacter, it's a very fastidious organism. Survive only up to 6 hours. And this is alkaline Peptone water, and all these are VR medium. Prepared for especially for cholera. If you suspect cholera, you have to transport these the stool sample in this transport medium. And And regarding this dilution, 1 ml of stool should be added into the 10 ml of transport medium. That means in 1:10 dilution. And this shows that the yogurt cup is not suitable container to collect the sample of stool because it's not a stool-kept one. And this is the best container that we should collect samples because you know Shigella is very infectious organism. That means around 10 to 100 organisms is enough for to get infected another person. Therefore, if you are handling sample that contains Shigella, you must be very careful to handle it when inoculating the sample into culture media. Okay, now we will talk about collection of CSF specimens. And can you tell me the indications when you collect a sample of CSF? Sorry?
Meningitis.
Yes, meningitis, very good. Can you see the video?
Yes, madam.
Okay. Meningitis, yes. Yes, very good. And before doing CSF, to get CSF, we have to do lumbar puncture. Okay. Before doing attempting to do the lumbar puncture, what are the things that you have to exclude from the patient? What are the contraindications to do a lumbar puncture? What's the contraindication? If as soon as you diagnose suspected of patient having meningitis, are you going to straight away do a lumbar puncture, or are you going to examine further to exclude some other conditions that the patient is having? Do you have any idea? You have to exclude the what? High intracranial pressure. Okay, if the patient is having high intracranial pressure, lumbar puncture is contraindicated. Okay, because it can cause to herniation and final death of the patient if you do lumbar puncture in a patient having high intracranial pressure. Okay, and then I told you earlier also that when you are collecting a sample of CSF, you have to maintain strict aseptic precautions. Because why do we need to, as I told you earlier, strict aseptic precautions means one thing is that we have to prevent organisms being introduced into the CNS, and also we have to prevent contamination of the CSF sample, which is normally sterile. Contamination means either from the environment or either from any other equipment. Okay, therefore we have to maintain strict aseptic precautions when collecting a sample of CSF. And always you have to keep in mind that sample collection should be done prior to antibiotic treatment. But if the patient has given already on antibiotics, what you can do is you can collect a sample of CSF just before the next dose. That means at that time we assume that the patient is having low concentration of antibiotics in his CNS. And this is a container. How do you describe a container? Again, how do you?
Sterile fruit cap.
Yes, sterile fruit cap container. Okay, and all these, if you are getting these bottles from the lab, always check whether the the date of expiry. Okay, because once they autoclave these tests, they give a expiry date. Okay, you should not use these bottles if it has expired the given date. Okay, and also you have to see whether it's dry or whether this bottle contains some little amount of fluid. Okay, if it is dry only, you have to use. And also you have to check whether the steady-state has worked. How do you know whether that steady-state has worked? That means it has autoclaved properly. How do you check?
The yellow color lines have turned to black.
Very good. Yellow color lines have turned to black. See whether the black lines appear on the steady-state. Okay, very good. Those are the common mistakes that we do when we do collect CSF samples in the ward. And usually we take small bottles because we can't take a large amount of CSF at a time from the patient. And also we have to collect usually CSF into 3 scoop of bottles, like one for sugar. It should contain the bottle chloride. The bottle should contain chloride, and then there should be another one for biochemical tests like protein tests and chloride, and there should be another one for culture ADHD results. Okay, and sometimes the clinicians prefer to have an extra bottle in case they need for further testing. Because again, lumbar puncture we can't do repeated. We do lumbar puncture in a patient. Therefore, we have to save extra sample in case we need some. As example, the clinician wants to do some sort of viral studies. They can use the extra sample. Okay. And what about this is showing penicillin bottle? What do you think about the using a penicillin bottle to collect the sample of CSF? What do you think? Is it good or bad?
It is bad.
Yes, very good. Tell me the reason.
Because penicillin can kill the organisms.
Other than that, because we think that even though this is a penicillin bottle, they autoclave the bottle and use it. Okay, in that case, autoclaving destroy all the organisms. Therefore, we assume there are no pathogens. But what are the other disadvantages of having this penicillin bottle?
The lid is not.
Sorry? Sorry? Yes, tell me something. It's okay.
The lid is not.
Yes, very good. The lid it's not a proper lid to cover the organism, because when you are handling the lid, you will see, when you are opening the lid, you will see our test contaminates the sample. Okay, you can see, because it's not again true test, sample gets spilled out, or it's not. Now you see, we can contaminate the bottle, inside of the bottle. We should not contaminate inside of a bottle at any reason, but you can see when you are opening the bottle, we tend to contaminate the sample. And also sometimes when we are going to open it, it will fall off again. And also even though we autoclave these bottles, we don't know how good it is, because the lid is a plastic, the rubber, we don't know how well it autoclaved in the autoclaver. Therefore, the better container is this type of straw-capped bottles, sterile straw-capped containers. And also, after that, once you collect the sample, what do you have to do? Regarding transport?
Should be transported immediately.
Very good. Should be transported immediately. And just think that you have done the LP or you have collected the sample at midnight, but the lab is closed. What are you going to do?
Should keep it at the room temperature.
Very good. But why not in the fridge? Why? Why not in the fridge? There should be a reason, okay? If you know the reason only, you can argue. Otherwise, without knowing the basics, it's not going to work. But if you suspect, if you are going to send the sample, the biological studies, can you keep in the fridge? And for bacteriological studies, can you keep in the fridge? That's the question you have to know. You have to answer also. What do you think? Yes, as you said, if you are going to send the sample for bacteriological studies, that's culture for bacteria, we should not keep the sample in the fridge. Why? Because there are certain organisms that can kill in a low temperature. What are the organisms? Can you tell me one or two organisms? What are the organisms? There are actually 3 organisms that can kill when they are in a low temperature setting, like Haemophilus influenzae, Streptococcus pneumoniae, and Neisseria meningitis. Are these positive organisms of meningitis?
Yes.
Yes. Yeah. Therefore, if we collect a sample of THS, we can suspect the sample may contain one of these organisms. Therefore, we should not refrigerate the sample. But in case of biological studies, you have to maintain the cell integrity of the cell structure. Therefore, in that case, for biological studies, you can keep the sample in the fridge. Just keep in mind, for biological studies, you can keep the sample in the fridge. You have to, because you have to maintain the cell structures to see the either antigen as well as to see the to culture the organism, to culture the viruses. Okay. Therefore, if it is for bacterial studies, we should not refrigerate, but for biological studies, we have to. Even for TB, we can. If you are looking for TB meningitis, you can keep the sample in the fridge, because why? Mycobacterium tuberculosis is not sensitive to low temperature. Okay, is it clear now? Is it clear?
Yes, madam.
Yes, that's if you know that. That's why I told you that if you know the basics, you can give answers. Okay. Because sometimes clinician may ask, this patient is having this one. What are you going to do for the sample? Okay, likewise you may ask. And also once you have to keep in mind, there's another important point, that you have to label the sample properly without changing the sample. And also you have to keep in mind, you have to fill the thickest form. Have you seen thickest form? Have you seen thickest form? When you are sending a sample, you have to label the specimen, as well as you have to send the sample with a properly filled thickest form. Have you seen thickest form? Yes or no? Have you seen thickest form?
No, madam.
Okay. Anyway, these thickest forms contain name, age of the patient, DHP number, ward, as well as a short clinical history. It's better if you can write a short clinical history, as well as whether the patient is on antibiotics. Okay? And giving a short clinical history is important, because especially for clinician, the microbiology lab or the microbiologist can get an idea what to look for. Okay? that's all for the collection of CSS specimens, and then we will go to collection of sputum specimens. Okay, can you see now? Can you see the, Yeah, okay, now they are going to collect a sample of sputum. What are the indications to collect a sample of sputum? What are the indications to collect a sample of sputum? Sorry?
Pneumonia.
Yes, very good. Pneumonia. Pneumonia, if you suspect pneumonia due to bacterial infection, we collect sample sputum. Okay, because I told you bacterial infection, because in viral infections, it's not possible to collect a sample of sputum. Okay, in viral pneumonia, we will see what are we going to collect. And here also, it shows the container, and what's the container? How do you say? This sterile wide mouth Kuppiya bottle. Okay. And then what advice you should give to patients? How are you going to ask the patient to put a sample here?
Properly coughed out samples.
Yes, very good. Cough deeply to produce the sputum specimen. Okay, and also that means we have to ask the expectorated sputum sample. Okay, and then we should ask the patient not to contaminate with what? Saliva. Okay, the patient should not put saliva onto the sputum specimen. Okay. Because again, saliva contains lot of commensals, therefore, if the sample that we are going to take, the sputum will not be a sterile one if it mixed with saliva. And also, for the collection of sputum, we can give commercially prepared one as you early, as well as sometimes in-house these prepared bottles like this Marmite bottles we can issue. Once after properly autoclaving, we can issue this type of bottles also. It's okay. Okay. And what about this type of penicillin bottle? Again,
we can contaminate the sample.
Yes, likewise in the CSF sample, we can contaminate the sample as well as now you can see how difficult it is to take out the lid sometimes. Okay, by trying to open the lid, the sample may spill out, posing a hazard to the one who is handling the sample. And also, you can see it's not a wide mouth one, therefore it's not possible to put a sample here. Okay? Because we should have a sterile wide mouth screw cap bottle to collect a sample. And for tuberculosis also, sometimes we give this type of yogurt cup. What do you think? What do you think? Pulmonary TB is caused by Microbiological tuberculosis. Okay, and sometimes when you are going for this chest appointment, you may have seen. You will see that the patients are given this type of container. What do you think of this one? Is it suitable or not suitable for collecting sample sputum for the diagnosis of TB? What do you think?
Not good.
Not good, but in case of the money, that if we are going to think about the cost effectiveness, we can still use, but we have to know what are the advantages as well as disadvantages of these yogurt cups taken as containers. Okay, what are the disadvantages? Yes, not a good container. We will talk about the bad points first. What are the disadvantages? Yes, you said that it's not a good one. Why?
It is not sealed and it can be filled out.
Yes, it's not a screw-type one. Therefore, we can't seal it. Therefore, it can, especially for pulmonary TB, patient having pulmonary TB, the one who is handling the sample can get infected. Okay, that's one possibility. Yes. And also, yes, that's a and also the other one is it is not possible to autoclave these type of yogurt cups. Therefore, we can use only we can call it clean one only. That's another disadvantage. But what are the advantage of this taking this type of one container? Because one thing is it cost is less. Okay, we can find any type of this one easily. And also the other one is that having a little amount of organism in sputum. That means having a bacterial organism in sputum. If you're looking for the Mycobacterium tuberculosis, is all right. That means because have you done Mycobacterium tuberculosis yet? No, isn't it? TB lectures have you done? TB lectures have you done?
No, not the microbiological.
Yeah, anyway, yes. And in TB, I will tell you in brief, in tuberculosis, the causative pathogen is Mycobacterium tuberculosis. It's a complex. You know what are the bacteria that in that complex. And the Mycobacterium tuberculosis usually resistant organism. Okay. And also to stain, we know that we have to use cleanliness and technique. And also we have to use special culture media like what we call low medium. Okay, in LG medium, we use certain malafin to inhibit the growth of commensal bacteria. Okay, in that case, because in sputum, if it's due to the tuberculosis organism will grow, inhibiting the autoclave this type of containers, it will antibacterial. It's a green in color. It gives it's a contrasting color to the colonies of the Mycobacterium tuberculosis. Okay, therefore, in LG medium, we can nicely see the presence of Mycobacterium tuberculosis colonies because it's the culture medium is a different color. Okay, yes. Therefore, pulmonary TB, if you can give sterile one, it's better, but if not, even by giving this type of one, can be accepted. Especially, they are doing only the acid fast bacilli to see the organism only. Even in culture, I told you that culture media contains antibacterial substances that inhibit the growth of commensals. And also in pulmonary TB, in other pneumonia conditions, we get down a single specimen of sputum from the patient. Okay, And for pulmonary TB, you have to get down 3 specimens from the patient. Why? Can you give me any reason to get down 3 specimens? Okay, this is telling that we can ask the patient to give a sample at the time of present. If the patient is suspected having pulmonary TB, we can ask the patient to give a sample at the time of presentation, what we call as hot specimen, at the time of hot specimen, and then we can ask another 2 samples as a total of 3. Okay, actually, why do you need 3 samples? Why not one, single one? Is there any reason to have 3 samples? To get down 3 samples? Even in renal TB, renal tuberculosis, you will have to get down 3 samples. Okay, 3 consecutive samples. And also, in renal TB, we ask for early morning whole sample for 3 consecutive days. Okay, keep in mind, in TB, we collect the whole sample. Okay? Because the presence of commensal bacteria in TB is not a problem because we are using, I told you, special culture media that inhibit the growth of commensal bacteria in the specimen. Therefore, and also excretion is intermittent. Therefore, it's better if you can have a whole sample and not the mixing sample. Okay, in renal TB, therefore we keep in mind we say all urine, early morning whole sample of urine for 3 consecutive days. Okay, and here also we take 3 consecutive samples early morning, preferably. And the reason is the same because I told you that the pulmonary, the organism present in sputum is intermittent. Therefore, we have to enhance the isolation, possibilities of isolation of the organism. Therefore, we have to get down at least 3 specimens. Okay? Is it clear now? Why do we need to get down 3 specimens? Is it clear?
Yes, madam.
Yes, for TB, it's 3 specimen, okay? And then, and also the once you collect the sample, we should not keep it in the sunlight, under the sun, there's hot sunlight because TB organisms can kill in hot temperature. And once you collect the sample, first we will talk about the transport of sputum specimen. How do you advise the patient to not advise? How do you advise the nurse or the lab? Yes.
Send daily to the lab.
Sorry?
Should be sent daily to the lab.
Yes, should be sent directly to the lab. What about the if they can delay in transporting? Can you keep it in the fridge or not?
Under 4 Celsius.
Under 4 Celsius. That means for what? For what organisms you can keep it in the fridge or what for not? What are those that?
For tuberculosis, you can keep it under 3.
Yes, very good.
Under 4.
Yes, for tuberculosis and as well as for virological studies, you can keep it in the refrigerator. But for other bacterial pathogens, can you keep the sample of sputum in the fridge?
No.
No. Yes. And what is the basis of that? What is the why?
Because some can't live in the low temperature.
Yes, as I told you earlier, it will suspect either of these organisms. Like here, Streptococcus pneumoniae, it is a positive agent of pneumonia, and also even other can cause pneumonia rarely. If the patient is having septicemia, they can kill in low temperature. Therefore, if you if you collect a sample of sputum for pneumonia due to bacterial causes, bacterial pathogens, you should not refrigerate. But otherwise, for TB, you have to refrigerate until you collect all three specimens or until you collect dispatch it to lab. Okay, it is clear now. I think it's clear now, and also always you have to change the sample with a properly filled thickness form. And once the lab receives the sample, they will do gram stain if it is bacterial pathogen, and then a part of sample will be inoculated into culture media. Okay, report of gram stain will be available on the same day or next day, but the culture may take 3 days. Okay, and for if you suspect tuberculosis, the house doctor or the doctor who is in charge of ward has to write the probable diagnosis as tuberculosis. Otherwise, the staff will do field news and asking for special organisms other than the normal bacterial pathogens. You have to mention it in the strictest form that you are look for Mycobacterium tuberculosis, okay, TB. In that case, they will do as well as the field news technique, as well as they will cultivate in LJ medium. Any questions so far? And for culture of Mycobacterium tuberculosis, you have to keep it for up to 6 weeks. Okay, keep in mind in day or 2 to 3 days time, it won't give results. You have to incubate it for up to 6 weeks. Okay. Now we are going to talk about some collection of samples from a wound. Can you see the video now?
Yes, madam.
Okay, good. Now this will describe collection of specimens from bones. Okay. And what's the best specimen to if you take an infected wound? What's the best specimen?
Pus aspirate.
Yes, very good. Aspirate of pus. And what about swab? Is it good or not bad? Not good. Okay, yes. And not satisfactory. Not satisfactory means why? That means swab is not a satisfactory specimen. Why? Because of 2 reasons. One is that sending a swab means that you are not getting enough amount of sample. Just swab means just to giving a small amount of sample. That means you are sending small amount of organisms. Therefore, you won't be able to, they won't be able to isolate the organisms because the sample is very less. And the second one is sending a swab means it will get dried out. Therefore, again, drying samples means the samples get dried. That means the pathogen also gets killed. Okay, and also the other reason is that these swabs, like cotton swabs, are inhibited to growth of bacteria. They inhibit the growth of the pathogens. Therefore, they give the lesser chance of isolating the organisms. Okay, those are the reasons not to send the swab, but to send a thus aspirate. So keep in mind, when you are working at house offices in the ward, always try to send the aspirate. Aspirate, or if not, if the patient is going, if it is a ward, if the patient is going to the theatre, try to take a tissue biopsy, okay? Because in a theatre, you can collect some tissues from aseptically. Therefore, these tissue samples are better than some. Okay, if the patient is going to the theatre, keep in mind to take samples for culture and ABSC and to send them quickly as soon as possible to the lab. Okay, and when you are going to collect and before collecting swab, you have to keep in mind the swab is sterile normal cell line. Okay, in that case, by doing that, you will be able to reduce you can prevent the drying of the swab. And also you have to keep in mind when you before collecting the sample, you should not clean the wound. You have to clean the wound to remove the commensal organisms, because if it's a wound like here, you know there are a lot of commensals on the skin. Therefore, you have to clean the wound prior to collection of a sample. Okay, what do you think? What's the disinfectant that you have, or what is the thing that you have to use to clean the wound? Can you use disinfectant like alcohol, like povidone? Can you?
No.
Yes. Then what can you use?
Sterile saline?
Yes, good. You have to clean the wound with sterile saline. Why not the disinfectant?
It will destroy the organisms that we have to check also.
Yes, very good. It will kill the pathogens that we are going to isolate. Okay, here. And here they have shown that by using a sterile needle and syringe, you have to take a sample of pus, and then again using the scoop technique, you have to cover it with the clip, and then you can send the sample. You can put the sample into the sterile screw cap bottle, or if it is not available, you can send the sample with the syringe itself by labeling, after labeling, but keep in mind to secure it safely by applying a plaster. Okay, now here they have used a sterile container to put the sample, and then again you have to keep in mind they have to label the sample, and also with the properly listed form. And this is if you are going to send the sample with the syringe, you have to secure the cap here with the starter, and also you have to secure the syringe with by putting a cardboard there at the distal end, allowing it not to move, and then you have to label it and send it carefully to the lab. But we should not practice that one regularly, but we can do it if we do not have any container to send. Okay? And this is the commercially available you can use this commercial available swabs as well. This is how to take a swab into here. And that's how you take a swab from a wound. You have to get as much as the fluid into the swab and keep it back. And then you have to label the tube and send it to the with the proper film, take the swab to the lab. And this shows it's better if we can soak it with normal saline prior to collection of swab, because it will prevent the drying of the swab. And you have to get the fluid or the pus as much as possible, as well as you have to swab over the edge of the wound. And details should be included, and then you can send the sample to the lab with a properly filled thickness form. And sometimes these commercially available swabs contain transport media in the tube. Okay, these are a bit expensive, but when to have a good quality sample, this would be better, because this will give higher rate of isolating the pathogen, because it does not get dried. Therefore, and also it's a transport media as well as it's a growth medium. Therefore, it will enhance the growth of pathogens, thereby allowing us to give a good result. These are init medium and Stewart medium, which can be used as transport media to transport the swab. That's all for wounds, and then we will now talk about collection of blood for ADHD. One of the important samples that we have to take in board. Okay, and other samples that can be other than the CSF and blood for culture ADHD should be collected by a doctor. Okay, house officer. Or internal house officer or the senior house officer. These other staff members cannot go blood for culture ADHD. Okay, therefore you have to know the proper technique to collect these samples. Can you see now?
Yes, madam.
Okay. They are going to collect a sample of blood for culture ADHD. Okay. Before that, you have to find out a site and then apply a tourniquet, and then you have to wear in that here. You have to wear gloves And once you identify the site, you have to clean the site with disinfectant. Okay? What are the disinfectant that you use for cleaning?
70% alcohol.
Is that only?
No.
Yes. What?
Povidone iodine.
Yes, very good. Very good. You can see that clean the site with the top and from outwards, then concentrically starting from the center and then going outward. Okay, this is the povidone iodine. The previous one is the 70% alcohol. Okay, and 70% alcohol, you have to keep for how long? First, we have to clean with 70% alcohol, and you have to keep it for 30 seconds, and then you have to clean with 10% povidone iodine, and you have to keep it for 2 minutes. Why? Why is that? Why? Povidone iodine, 10% povidone iodine, we are keeping for 2 minutes. Why?
For organisms to get destroyed.
Here, for organisms to get destroyed because it's in the commensal area, and also povidone iodine has a residual action. Can you remember? It has a residual action, therefore it takes time to show it, to give it full activity. Okay, therefore you have to wait for 2 minutes to get it on the site. Okay, and then in this case you have to wear sterile gloves. Okay, and also then you can see it has wearing gloves. In this case you have to wear sterile gloves because I told you we are doing CSF, collection of sample of CSF as well as collection of sample of blood for culture in this case. You have to wear sterile gloves. Okay, the skin cleaning method is same for when you are taking sample of CSF. Okay, keep in mind, I didn't mention that in that part, but keep in mind that if you are going to take, when you are going to take CSF, either CSF or blood, the skin cleaning procedure is the same. Okay, you have to clean with 30% alcohol followed by 10% povidone iodine because reasons are you are entering into sterile site, therefore you have to maintain aseptic procedures, maintain aseptic condition. In that case, you have to use 2 disinfectants, 2 antiseptics. Okay, because we are using these disinfectants on the skin, therefore we call them as antiseptics. Okay, but otherwise, if you are going to take that for biochemical studies, you don't need to clean the skin with 2 disinfectants. Okay, is it clear now? Is it clear?
Yes, madam.
Okay, and if you are giving IM injection, if you are giving a vaccine to a person, you don't need to clean the site with 2 disinfectants. Just cleaning it with 70% alcohol is enough. Okay, because we are not doing aseptic procedure there. Okay, but here, as we are doing aseptic procedure, we have to clean the skin as much as possible by using 2 disinfectants. Okay, yes, we will see the video. And this is how you clean the site concentrically. And then we have to use a disposable syringe and needle to draw the required volume of blood. And ideally, we should first remove, if the same person is cleaning and if the same person is going to draw the blood, you have to take the gloves. Okay, you can see that the used gloves was disposed into the bin, clinical waste bin, that is what we call a clinical waste bin, and then have to wash your hands with soap and water, and then only we have to take a sample of blood because you could see that you saw that cleaning the site of puncture, the gloves gets contaminated with the surrounding of skin contaminants. Okay, now you can see he's going to wear another pair of gloves, sterile gloves. Okay, you can see that sterile gloves are used keep separately like this, and you have to wear this sterile gloves to get the sample of blood. And what do you think about the volume of blood? For how much of blood do you need to draw? For an adult, what's the sample of blood? How much?
5 milliliters, 4 to 5 milliliters.
Yes, very good. 4 to 5 from the adult. From children? From children?
2 to 3 milliliters.
Yes, 2 to 3 millimeters. And then from neonates?
1 milliliter.
1 milliliter. Okay, good. And then what's the, I will come to that point. And okay, now he is going to take blood using a sterile needle and syringe. And then it's better if you do not touch the area because as you have already cleaned the area, you should not touch the area to find out the vein, okay? And then once you get the required amount of blood, you have to remove the tourniquet and then put a plaster for the swab. Now we will see what are the different blood culture bottles that we have. Yeah, okay, now it is going to show us different culture media that we have, okay? And this is the one that we have in our laboratories, how in-house prepared one, okay? You can see it's a universal bottle that contains the blood culture medium. What's the blood culture medium? Do you have any idea? This is BHI, brain heart infusion broth. BHI broth, brain heart infusion broth. And then there should be a dilution. We have put here around 10 ml of 20 ml of media because we need to dilute the sample of blood into 5 to 10 times. Okay. And then these are the commercially prepared blood culture bottles. If you have chance to go to the microbiological laboratory, you can see there are automated blood culture bottles, what we call as automated blood culture bottles, whereas these are called as manual blood culture bottles. What's the difference between manual and automated are? Manual means we prepare these bottles in-house in our laboratory itself, and then put in BHI, and then we put a sample of blood here, and then we incubate in our incubators, okay? And then we look daily, look at these blood culture bottles daily to see whether there is any visible growth. By how do we see a visible growth? By this, we can see some cloudiness in the bottle, and then we suspect that there is a visible growth in the blood culture medium. But in contrast to that, on the other hand, we have this automated blood culture bottles. That means we put once we put the sample of blood directly into the blood culture bottles, we put these incubators into the automated machines. Okay, these are actually incubators, automated machines, and they incubate the sample, and as well as once there's a bacterial growth, they will alarm it. They will signal it for us to see. Here, for automated ones, we don't need to look at the bottles daily because once we put there, it will keep for 5 days, or sometimes if it is a bacterial endocarditis or if it's a typhoid, we will have to keep for more than that. whatever it is, if it is positive, it will give a signal. In that case, once it gives a signal, we have to get it out, and then we have to inoculate into suitable culture media to see the growth. Actually, this automated ones are very easy because we don't need to do seed daily. But on the other hand, these are expensive. Okay. There was one question in previous year asking about the advantages and disadvantages of this manual versus automated blood culture bottles. And the other advantages you can see in these bottles, you can see some bead-like structures, small bead-like structures. Those are resins actually, which absorb the antibiotics in the patient's blood sample and also absorb the toxins produced by the bacteria. Therefore, we assume that they give a better isolation rate. And also this one different type of commercial bottles, and this one also contains charcoal. That's why it gives a green color. And then in-house prepared blood culture bottles, we have large bottles for to take blood from adults, because we need to take 4 to 5. We have to put to 4 to 5, and then also we need to dilute it 6 to 5 to 10 times, and then for the automated commercial bottles, we have different bottles. This is a pediatric in-house culture bottles which contain, because we are putting amount 2 to 3 ml of blood, and this contains about 9 ml of VHI broth. Therefore, the dilution in that case 1 to 10. 1 ml, if we are going to add 1 ml into 9 ml, the dilution is 1 to 10. And in automated, these are plastic bottles, commercially available ones. And there are different culture bottles like for aerobe, for anaerobe, as well as even for microbacteria, and even for fungi, they have different culture bottles. And once we draw a sample of blood, we have to insert it in the ward itself, okay? Because you have to keep those things in mind, because you are the person who has to insert the blood sample into the bottle. Okay. Now this is how they are going to do it in in-house prepared ones. There's a plaster over the lid, and you can see there's a small hole on the lid, and then you have to clean the lid with the 70% alcohol. Okay. Remove the plaster and clean it with the 70% alcohol and put the necessary amount of blood into the blood culture bottles. Okay. And earlier, what we practiced was is to change the needle before inserting into the blood culture bottle. But now we have discouraged it because there is a higher risk of getting needle prick injuries. Okay. When you are doing these activities, you have to minimize these sharp injuries. Okay, now because you know that there are a lot of blood-borne viruses, therefore you have to minimize injuries from the sharp objects. Therefore, now we do not ask them to change the needle before you insert this into the blood culture bottle. Now you can also show how he connect the needle by scooping technique. Okay, you don't take the cap onto your hand and then you don't do it. You should not do it. But what you can do is you can do scoping technique. And then keep in mind to discard the sharp or the needle into the sharp beam. Okay? Those things, again, even last time there was asked a question asking about the sharp beam. Keep in mind, needles you can't discard as a clinical waste. Okay? For the needles, you have to put them into the sharp beam. So you will learn this, what are the properties of sharp beam and what do you keep in mind when you are using the sharp beam. Those things you will learn in infection control lecture. Okay. And then you have to shake it, the culture bottles to mix it thoroughly. Okay. Otherwise it will get hot. You should not allow it to rot. And then, are there any questions? Then we will move on to respiratory specimen collection. Other than the sputum, can you see the new video?
Yes, madam.
Yeah. Now she is demonstrating how to collect the sample of nasopharyngeal swab or nasopharyngeal aspirate for when the subject upper respiratory infection, especially in viral pneumonia. Okay, viral pneumonia, you know that sputum, they don't produce sputum, it's a dry cough. In that case, we have to take upper respiratory specimens. Okay. Now she is demonstrating how to take the nasal and throat swab, and then now she is explaining it to the patient. Okay, in similar. This he can understand, and then now you can see the person who is collecting the specimen should wear appropriate personal protective equipment. In that case, you have to wear, you don't need to wear sterile gloves, clean gloves is enough, and then you have to use, wear a gown and a mask as well as the face shield. Okay. When we talk about the mask, it should be a N95 mask. Okay. Can you tell me why you are wearing an N95 mask?
Because it's a aerosol producing procedure.
Very good. It is because it is a aerosol generating procedure. Okay, even if it's respiratory infection could be transmitted due to either via droplets or via airborne particles. Okay, even though it is a disease that transmits aerosols can be generated during procedures like this. Even if the doctor is using suction for a patient, those things can generate aerosols. Okay, in that case, we have to take precautions not to get infected. Therefore, we have to wear N95 mask. You know, N95 mask we use when we suspect airborne infection. Okay, that means it prevents entering of particles less than 5 micrometers in diameter. But here, as N95 mask is not available, if there is K95, and the quality-wise, K95 mask is a bit lower than the N95 mask. N95 mask is not available outside, it's only available in hospitals for care of patients. Okay, here we don't have other choice. It's not without using a K95 mask. Okay. Is different from what I want to say. The K95 mask is different from N95 mask. Okay, you can read it out later on. Now she's taking a throat swab, and then you have to send the swab towards the your back of your throat, and then you have to swab the area of tonsil and posterior pharyngeal wall and any other inflamed area. Okay, and before that you have to put a tongue deep pressure, otherwise tongue will touch on the top. Okay, and we should not touch the other areas with the soft. Okay. And here the source of and nasal swabs are all inside. And then what is this medium? That is the viral transport medium. Okay. And when you are collecting samples, when you are sending a sample, you have to collect it with the viral transport medium and keep it in the fridge until dispatch lab. And then when you are sending the sample, you have to send it in ice. Okay. All three things you have to write, okay? Some forget about to write about the refrigeration, okay? Once you collect the sample, put it in the medium, that is viral transport medium, and then keep it in the fridge until dispatch lab, and then you should transport the specimen in ice, okay? All these aspects you have to write, and then we are not going to put VTM into VTM. Actually, we put VTM if it is for biological studies, and also not for all subs. For all samples we don't put VTM, and like if you collect sample of TC for viral studies, or if you collect sample of serum for viral studies, then we don't put VTM. Okay, but for swab and upper pharyngeal secretions, for those things for viral studies, we put VTM. Okay, keep in mind that also. And then we will see about the nasopharyngeal, last one, nasopharyngeal swab. Okay, now this again very common question that you ask in various areas. This is a mucus aspirator or the nasopharyngeal aspirator. You will see how it is going to be collect a sample of nasopharyngeal aspirator. Okay, this is again we using when we suspect viral pneumonia. So, and this end goes to the nasopharynx of the patient. And we send it along the inferior wall of the nose, and then until resistant encounter, and then we have to get down the sample into the container. Okay, we will see how it is being done, and then we have to make a inside pressure inside here. Okay, we have to make a negative pressure inside here, create a negative pressure. And then for that we have to make negative pressure by using attachment syringe here, and then the sample is once we collect the sample, and then we have to put VTM. And sometimes sample may not be so much, therefore the sample may remain here or inside till the tube. In that case, we can put VTM like this. Okay, if we have a lot of samples here, we can put directly VTM onto the sample. But if not, that's how we take VTM into this container here. Okay, mucus aspirator. You can see again. This is VTM, and also again by attaching this syringe, we maintain a negative pressure here, and then you can see the VTM goes into the mucus aspirator container. Now you can see VTM is coming inside the container, and then once you finish it, you can remove this upper part. You can see the upper part, upper lid, you can remove it, and then And then how are you going to cover it? Because there is another lid, bottom side of the container, and then you can put it here to cover the container. Now, this nasopharyngeal activate is inside this BPM. And then you have to label it and then keep it in the fridge and then transport in ice with a properly labeled viscous form. Properly filled viscous form. And there are some other swabs to collect samples. Here there's one set containing both viral transport medium and a nasal swab. And then you can see there are two swabs. One is small one and a large one with a larger thickness. Smaller swab is to take the nasal swab, nasopharyngeal swab, and the thicker one is to take a throat swab. And then you are asked about viral pneumonia. They will ask about what are the specimens that you collect. Okay, if you write as sputum, it is wrong. Okay, in viral pneumonia, you can't take sputum because patient doesn't produce sputum. In that case, you have to take either nasopharyngeal activate or nasopharyngeal swab or nasal or throat swab. Okay, those are the specimens that you can collect to diagnose viral pneumonia. And this is another throat swab which is available in outside commercial available one. This seems to be a little bit disadvantage of being a thick one, because it's less flexible. And so these swabs can be used for other collection of our other samples like eye swabs, bone swabs, and those things. And then there's another kind of swab. This is used for collecting nasal swabs. You can see a small, very thin and flexible one to collect a sample of nasal and pharyngeal, either nasal or pharyngeal samples of. And this is another kind of throat swab with a wire. This wire is also flexible and much enough to collect the throat swab. You can use it as again another throat swab. These are different kinds of swabs that you can use in to collect sample of patients. And this is an important one. This is what we call as nasal swab, and to collect the specimens of walking cough. Okay. Okay, and this is a nasal swab to collect swab when you suspect walking cough. And what's the positive outcome from walking cough? Can you tell me what the nasal swab is specifically designed to collect when you suspect whooping cough in the patient? Okay. What's the positive agent of the whooping cough?
Bordetella pertussis.
Very good. Bordetella pertussis. Okay. Those are very delicate organisms. Therefore, we need to have special culture media, especially containing either charcoal or other. There are many culture media like both bamboo and charcoal media, and also even in the furniture swab also there are charcoal. Okay, because it's very delicate organisms. Therefore, we have to have factory organisms. Therefore, we have to have special culture media to isolate the organism. Okay. And actually, this is not a cotton swab. These are dactyl-alginate swabs because I told you that because this cotton swab, I told you earlier also, it inhibits the growth of organisms. Therefore, these furnaces swabs actually contain dactyl-calcium-alginate swabs with charcoal. And earlier we used to do cup plate method, but nowadays we don't advise to place a cup plate. That means we ask the patient to cup. We give a patient to blood culture plate, and then we ask the patient to cup onto the plate. But we do not advise nowadays because of transmitting the infection to other surrounding persons. And once you collect the sample, furnaces of you have to send it to the keep inside the tube and send it to the laboratory. Okay. And there's another swab that you have to keep in mind is the anterior nasal swab to detect Staph aureus carriers. Okay. These swabs, even any type of swab can be used to collect anterior nasal swabs. Okay. And now so far you learn about difference of throat swab and nasopharyngeal aspirates or nasopharyngeal swab to detect the upper respiratory infections or viral pneumonia. And furnaces swab we use to detect suspected cases of whooping cough. And then also anterior nasal swab we detect Staph aureus carriers. Okay. And why do we call it anterior nasal swab? Because we swab the on the inside, just inside forward of the nose only. We do not go through the nose, but just the inside of the external side of the inside, just close to the external orifice. We swab that area. That's why we call the anterior nasal swab. And this we use to detect the Staph aureus carriers. Okay, you will learn how to go clinical, so you will learn in certain surgical, in certain conditions, we do look for Staph aureus carriers. Okay, we call it as MRSA screening, especially if the patient is waiting for cardiothoracic surgery, bypass, coronary bypass grafting, or long the orthopedic surgeries like hip surgeries or so on. We do MRSA screening, and then for that purpose we use this anterior nasal swab to detect MRSA carriers. Okay. Okay, that's all for collection transport of specimens. And shall I ask a question? And what's the contraindication to do a swab? Can you tell me one contraindication to do a throat swab? One condition that we should not attempt to do a throat swab.
Tonsils.
Tonsillitis, no my dear. Tonsillitis we do because that is Streptococcus pyogenes. We do in tonsillitis we do actually throat swab if you want to isolate or if you want to see the pathogen. Any other condition? They are
acute epiglottitis.
Very good.
Acute epiglottitis.
Very good. Acute epiglottitis we should not attempt to do a throat swab. We should not collect a throat swab because by doing it, it may lead to spasm and then it may can cause obstructive airway and leading to death of the patient. Okay, therefore we should not, if we suspect acute epiglottitis, we should not do collect a throat swab. Okay. That's all for specimen collection transport of specimens, and those are all bacterial. For viral studies, you have to keep in mind sample, you have to put the sample into VTM, viral transport medium, no, but not the feces or blood for analytical studies. Other specimens you have to keep it in, put it into the VTM and keep it in the refrigerator, and then change in ice. Okay, all these aspects you have to try to get the full mark. And another thing that you have to once you work in ward, you should not send a urinary catheter tip because it's not a good sample. Okay, you should not send a urinary catheter tip for culture ABC. It's not good. And yeah, those are the things that I have to mention. And when you are collecting a sputum, you should not collect contaminated saliva. Those are the specific points that you have to remember. Okay. Any more questions? Do you have any questions?
Excuse me, madam. What is meant by bronchial wash?
What is sorry?
What is meant by bronchial wash?
Yeah, bronchial wash actually it's not possible to take by normally. When you are doing bronchoscopy, you put a small amount of fluid into the bronchial and then take the sample back. Those are the considered as bronchial washes. Also bronchoalveolar lavage. Those all we can to detect lower respiratory infections. We can take bronchial washings as well as bronchoalveolar lavage. BAL, we said as BAL. We take this type of specimen, especially in ICU patients, because they can't give out a sample of sputum if they are connected to ventilators. We can easily take this type of specimen. Okay. Bronchial washes as well as bronchoalveolar lavage. Okay, all these specimens can be taken to detect lower respiratory infections as well as sometimes in upper respiratory infections also. Okay, is it clear now?
Yes, madam.
Yeah, any more questions?
Madam, why do we apply skin antiseptics concentrically?
Because if you are coming inside, always we have to have a highest sterile condition over the site of function. Okay, at the site of function we have to have we have to clean it thoroughly. Therefore, concentric means inside to outside. Because inside if you think the skin gets contaminated with organisms, there are commensal organisms. Therefore, we have to have a minimal contamination at the site of function. Okay, that's why from the site we have clean first and then go outward. Okay, otherwise if you do the cleaning from outward and then when we come to the center, it will already get contaminated with the organisms. Okay.
Thank you, madam.
Yes, we have to begin at the center. Any more questions? Any more questions? No? Okay, so again, if you have any questions, you can send me an email or send an SMS. I will try to answer. In that case, can I wind up? Okay, no questions. In that case, I will, okay. Thank you for